of Us research program.
Yes,
All right.
correct.
And I want to add that it's at the Miller School of Medicine, although it's not related to us, all right? But the Millers do have a fine reputation. Thank you for the huge donations to our care in Miami-Dade County. So, first of all, why don't you tell us a little bit about yourself? You're awfully young and you're an MD with a lot of experience.
Thank you so much. I mean,
Yes.
like, that's a good compliment. So, I'm a foreign physician from Venezuela. I have more than 20 years of experience leading large teams. I dedicated part of my career to do research. So I currently work at University of Miami and overseeing several projects there. So two of the largest projects are the COVID-19 vaccine clinical trial and the All of Us research program. The All of Us research program is the largest grant that University of Miami Miller School is handling and managing right now.
So, did I read that you were an anesthesiologist?
Yes.
Right? Really? You put people to sleep, right?
Yes, that's true.
When you look at how the healthcare providers do operations and procedures, the concept of anesthesia is really amazing,
It
right?
is. It is.
And so you decided to move from anesthesia to this.
Yes.
What caused that?
So, first of all, being an anesthesiologist is giving me the leadership, the strength, and the possibility to oversee a lot of people, and the passion to do research, the passion to understand how you can change life, just knowing where the diseases are coming from and knowing how to treat them is so passionate. It's unbelievable. So then I came to this country and I have this huge opportunity to work with a prestigious institution like University of Miami, and that's how I just switched my career to do research.
So how did the name of All of Us, how was that generated? Right?
All of Us is the NIH initiative. It's a National Institute of Health initiative. The idea of All of Us is inclusion. So the original idea is to create a huge database, that enormous database that includes diverse populations. So our goal is to enroll 1 million participants in this
Mhm.
program. And within this million of participants, we want to incorporate minorities. We want to incorporate diverse population. So this huge database is going to contain your DNA information and some basic information, your lifestyle as well, so that future research or other investigators can use this database to create new programs, new treatment, and those new programs and treatment going to help a lot of people.
When we see on many applications, many healthcare forms, it asks your gender and it asks if you're African American or the term is misleading, white or Anglo non-Hispanic. That's just not for curiosity. There's a reason for that.
There is a reason for that
And
because
what is that?
everybody is different. So you're unique. You have your DNA will make you a unique person, but you also have a different lifestyle. You have day-to-day activities that are different for everybody. Latinos are different to white Americans. African Americans are different to Latinos. So each of us are unique person. And the reason why we want to incorporate our communities and have representation in biomedical research is because we can develop treatment that can include everybody, that can be available around the world. Because I mean, all of us are different. As I said, that's the purpose of the study. All of us, inclusive.
We were talking with one young gentleman who had a schizophrenic break about 10 years ago, and he's been treated. And he came in, and he wrote a song and the music, and he sang it, and the name of it is "You're Not Alone." And so I think when we see that, where we want to be part of something that's bigger, we don't want to be by ourselves. So when you say all of us, all right, whatever that means to you, that could be all of us in Miami, it could be all of us in Kendall, all of us at the University of Miami, to where's that sense of inclusion. And I don't know about other parts of the country, but certainly here in Miami, we're so diverse and we have such a huge range of population of people.
That's true, and we also are unique. That's why University of Miami is so important in biomedical research. We have the most diverse population across the United States. So our Latinos are different. We have Latinos from Cuba, from Venezuela, from Colombia, from Argentina. So we have Latinos coming all over the world, and that's what makes us unique, also desirable to do research here. Because I mean, the way that we see research now is more inclusive. As much as we know about different population, we can create more. We can do more.
So, Dr. Riccio, how do you get patients to participate in this program?
It's pretty simple. Everybody that is above 18 years old is invited to be part of the program. So we're going to ask you some personal or basic questions about yourself, about your health history, your family history. We're going to do a biospecimen collection to analyze your DNA. And we're also going to incorporate everything to your lifestyle. So it's pretty simple.
When we look at the big drug companies that developed COVID and they come up with their protocols, how many people were actually involved in the pre-release of some of that vaccine?
So it was a lot of people, and I'm going to tell you, I'm so passionate about how COVID changed the way that we see research, because now after COVID, research is so highlighted. Without research, we wouldn't be able to develop a vaccine. We wouldn't be able to understand um, what how COVID works. We wouldn't be able to understand why COVID is affecting different people.
So we know that some of the big drug companies now testing younger people.
Mm-hmm. That's true.
So how does that happen for the parents to say, I want to get into that?
That's something that always said our participants, our volunteers are the real heroes, here. I was overwhelmed the way that people were putting themselves out there to be part of all of each COVID-19 protocol that we were doing. So they volunteered themselves without even think about it. They wanted to remove this terrible disease from the world. And I'm so passionate that people are educated now and people understand the importance to be part of the programs or the research component that is literally overwhelmed. We can't even say enough thank you to those participants.
When people get involved like that, it's bigger than yourself.
It's
right?
big, yeah.
And in the simplest of ways, littering, all right, you're not taking into account everybody else. And so and dumping on the side of the road, you're not taking into account. And sitting at a stoplight, and when it turns green, you speed away instead of stopping for another second and looking around. So there's a goal the University of Miami All of Us program has to reach a certain number of participants.
Yeah, so we already were able to enroll 11,000 participants. Our goal is 40,000 participants. University of Miami is the leader of the Southeast Enrollment Center. We partnership with other universities, prestigious institutions as well, like Emory, Morehouse School of Medicine, University of Florida. But what makes us unique is our diverse population. So what we want is to contribute with this enormous program that's gonna develop a huge database. I think the most amazing database here at the United States is to incorporate our diverse population to that program so that our communities can have some benefits for that.
And people from around the world will be able to look at your study. They're going to say, here's what happened with Hispanics from Cuba, Venezuelans, Nicaraguan, Hondurans. Right?
That's absolutely true. So as I said before, the idea is to create, I mean, this is one of the steps to move forward to precision medicine. Precision medicine is the future. It's the way that disease will be treated according to your information, your unique information. So your DNA, your lifestyle, your health history, your family history. So having the opportunity to develop in the future precision medicine is going to give us a better understanding about how disease impact more communities than other communities.
So that's really one of the great reasons to participate in studies is that you can. It's not just helping yourself; it's helping your family
Exactly.
and future generations and people from across the world.
Exactly. And I'm going to tell you more. So one of the examples that I'm going to bring about this huge database is when we were in the middle of the pandemic. I mean, we still are, but in the worst moment of the pandemic. So we already have this database there. We already have all the information. So what all of us did was running or testing antibody in those samples that we already have. And we found out something amazing. COVID-19 was here before even we received the first report. And we didn't have to do anything extra. We just have all the information there from our 400 participants that are now part of the database. So I said before, we want to reach the goal of 1 million participants, but we already have 400 participants, almost 400, and 50% of them are already diverse population, minorities, and having this available and being able to understand a little bit how COVID is working and how COVID is affected different communities is amazing.
So whenever you have people that are included in a club, there's also people that are not in the club. So
Exactly.
who's not participating?
So it's not a secret that there's a lot of hesitation across Latinos population, African American. So that's something that we need to work as an investigator, as a healthcare staff. We need to educate our communities and let them know how important is their participation in research. So we know there is a lot of mistrust, there is a lot of misinformation across the specific communities, and we want to invite them and let them know how important is that their contribution to research.
So one of the things we certainly saw with the, excuse me, pandemic, that the county went out of its way to make sure that the vaccine was available to those people that were not as connected, that had some a great deal of hesitancy. And I certainly hope that the people that were hesitant before have sort of changed their minds because of what's happening.
Mm-hmm.
And a lot of people are going to get sick. A lot of people are going to die unnecessarily.
Yeah.
So tell us about your role and your team's role with this whole program.
So we have a team trained to assist any participant or any person that want to be part of the program from the beginning to the end. So we are there to answer any question, to assist you through the consent process, to be with you in the in-person visit. This enrollment include a component that you can do from home. You're just going to create your profile. You're going to put your information there, but then you have to come to our in-person visit, and in that visit, during that visit, we're going to be able to answer more questions, and you will be under a physical measurement. It's a short visit, 30 minutes, and that's when we're going to take the biosample collection. So our team is prepared to be with you from the beginning to the end of the enrollment.
And what particularly will you be looking for when you bring a patient in?
So we are specifically want to include minorities. We want to review your basic information, your lifestyle, your healthcare history, your family healthcare history, and then we're gonna collect your DNA so that in the future you're gonna receive those results. You're gonna receive some recreational results like ancestry, which is very interesting. People are so eager to know where they're coming from. So we have other recreational results that you're gonna receive as well. Like for instance, if you are lactose intolerant, but the most important are the results that are gonna be related to your health. As you're gonna be able to share those results with your doctor. But I think we need to highlight that being part of this program is helping you, your family, and your community, as we mentioned before.
So one of the immediate fun things is when you do the DNA and see where you were from. All right.
It's so interesting.
I was with a lady doctor, and she said, "Where are you from?" And I said, "Miami." No. And then she says, "Where are you from?" And I said, "Ukraine." She says, "I knew that." Right? She was Russian. And since that awareness started, I realized that my grandfather, my father's father, was born in Russia, and they changed the name. And when you look at that, there's this togetherness that you feel, and that there's this calmness about where you've been, all right, and where you're going. So when all this program gets the data from 1 million people, that sounds like a pretty long-term project. Where do you keep all this stuff, all the information?
Yeah, that's a good question. So we gather all this information in something that we call research workbench. So the research workbench so far has we're halfway, 400,000 participants. Sorry, all this information is de-identified. So and it's available for future research. Other investigators needs to apply to the All of Us research program to be able to use this data. And we are very selective. So we want to hear the proposal. We want to make sure that that proposal makes sense. We also going to ask the investigator to go to a training process. And there is no way that this data will be de-identified.
So let's go over again. So somebody participates. They go down, they see you after they do some, and you meet them, and their name is there. So how does it get de-identified?
Immediately when you enroll in the program, you are assigned to a number. We call that number P number, and it's totally detached to to your personal information. So the personal information, you are the one who gonna see your personal information and your PIN number. The investigator is just gonna see your PIN number, never gonna find out who you
By the way, I happen to remember my ID number from Miami Dade College. I can't get it out of my head. What's your number, Mr. Miller? And frequently they say, "How do you remember that?" I said, "I don't know. It got in there." So people can have that information, feel confident that
definitely. And you're gonna have a profile. You're gonna be receiving notifications. You're gonna check your profile all the time. It's unique. I mean, and the results are coming to you. We're not gonna share your results with anybody. It's direct to you, and you are the one who owns your results and gonna know what to do with them.
By the way, about 15 years ago, an 85-year-old guy comes up to the office. He says, he says, "We're related." And I said, "Why? You got some money for us?" and he brings in this whole history. And I said, "My aunt, who is about your age, is here." I go, "Get her." Sure enough, when they were kids, 70 years before, they would play together. They shared grandparents somewhere along there. And to see that connection, it's really good. But what's the All of Us program going to do to help people in Miami-Dade County to get vaccinated?
So that's important. So what we're doing so far, beside the antibody test, we are creating some pilot programs to understand how COVID affect our communities. That's one step to do so. So we also are develop new programs to teach to let the community know that they need to be part of any research or any component of research, because as I said before, it's not just for you, it's for everybody, it's for your family, it's for your community. We know there is a lot of hesitation. We know that, and we know what specific communities have more hesitation to be part of research. And we are, I mean, as a Latina, for me, it's a compromise. So I need to educate our communities and let them know, look, it's safe. We have a lot of regulation around research, and then there is no way that so far, I mean, in this new era, you're going to be hurt by research. I mean, there is a lot of history about how research was conducted previous, but now it's not like that. It's a lot of compliance regulation that we need to go through, and we need to let them know. We need to inform our communities.
So has the information changed a little bit in the last couple months about how to communicate with the non-vaccinated people? And how is it the information that you have going to help somebody change their mind to get that?
So that's an example when I talk about the antibody test, for instance. So we have this data already there, and then we're gonna just run the antibody we did with the antibody test, and we find out, look, having this amazing data that have your information as a Latino, as an African American, because I mentioned that we have 50% of people, of population, diverse population in this data. We identify people that were hit by COVID before, and we're gonna learn about why COVID is different from Latinos and African American than white Americans. So we're gonna learn that, and we're gonna share that information with you.
So the effect that it has, I know it's hard to say that it's an absolute because there's so many factors that go in, but are you implying that the way Hispanics get affected by it might be different than African Americans?
It's definitely, it's not as totally yes, but we assume it is, because everybody has different lifestyle. You eat different than me. Eat different than other Latinos. I mean, everybody is unique. Everybody has different activities, different lifestyle, different way to behave, different health history, and we are learning. It's not a fact, but we already know that some people get more affected when they're sick.
Correct me if I'm wrong, but I understand that African American males have a higher rate
Definitely.
of prostate cancer than their white counterparts. So that's something that you know. So if you were a healthcare practitioner and you have a patient that's 50 years old,
Definitely.
hey, listen, Joe, you need to do something because we know based on those things.
Exactly, and it's exactly if we are being there, put ourselves out there and be part of research, we're gonna learn other factors that can affect our health, and we're going to be able to prevent those factors. We're going to be able to create new programs, new prevention programs and treatment that would be fit or that would be better for you. So that's the idea.
So there's an African-American gentleman I know who's 55. He lives with his mother, who's 75, I think. And I said, "Do you need an appointment for your shot?" And he says, No. A week later, I asked him, this is a couple of months ago. And then finally he says, I said, I'll make the appointment if you want me to. Okay, I'm going to go. He goes, and I could tell he didn't go. And so I said, I waited a week and I go, so when do you go back? He said, they're going to call me. I go, get over here. And I sat him down. I said, listen, you don't have to go. I said, because I know you didn't. I said, but is it important to you? And he said, yes. I said, why? Well, because I live with my elderly mother. I said, so knowing that, you still haven't done it. He says, that's right. He had to get a family member to convince him to go do it. Right? Otherwise, he wasn't going to do it. Too scared or whatever it happened to be. But when I watched that, even with his knowledge that he could get his mother ill, it wasn't enough to move him by
To
himself.
move, yeah. Yeah, that's true. One of our, I would say, not our secret. One of the strategies that we implement here in Miami, we have a diverse staff. So we have a staff that is like you. So we have white Americans, we have Asian, we have African American staff, we have Latino staff that can better understand you as a participant, as a volunteer. They can relate to you. Our principal investigators are diverse as well. So that's also important. So being able to say, look, you are like me. So I'm in this side of the science, but I want you to be with me in this side of the science because we're gonna help our community together.
So you've been a practicing physician for
Mhm.
20 plus years. You must have been like 12 when you graduated. But Dr. Riccio, there a huge percentage of healthcare providers and first responders have made a choice not to vaccinate.
It's
How
unbelievable.
how can you how do you explain that?
It's unbelievable. I'm going to be honest. I have no explanation because I can't believe that somebody that was in seeing what COVID did has hesitation to get the vaccine. But in other hand, I have a lot of volunteers, not just healthcare provider or people that just was overwhelming. The way that the phone was nonstop. They want to be part of the COVID-19 study. They want to do whatever COVID-19 study was available just to stop the disease. And that's what motivate us. Not people that say no. We're motivated for people that say yes. We want to be there for and give them the opportunity to shine and be hero because they are the real hero and give them as an example to other people that say, look, I have a station, I don't have enough data. I mean, that's something that we need to improve, but definitely we need to highlight the good thing
If
about
somebody
risk.
wants to participate in the program, they can go to all of us.
Is join all of us at org/Miami.
Okay.
So that's the easy way. Otherwise, we have 5 clinics at the medical campus here at University of Miami Middle School. So we have 5 offices. So we can definitely coin and join us to the program. You're gonna receive a phone call from one of
And they
our
go
team
right on
members,
Google, put in all of us program, University of Miami. They're gonna
and
find
that's
their
gonna
way.
highlight a profile.
Let's look at human behavior. 3 weeks ago, you could go to Tropical Park and you could get your shots and your tests, and with almost no waiting. I went 2 weeks ago. I said, I'm just going to go back. I want to see. And I frequently got tested, and I had both my shots in January. But I would frequently go before. I wanted to see the process. What was that like? What kind of waiting was there? Who was in line? How long did it take? So I go to Tropical Park, drive way in. It was about a half an hour. Okay, no problem. On Sunday, the line was out to Bird Road.
There you go.
So what happened to our psyche from the Sunday before? I went on a Sunday. There was a half an hour maximum waiting, maybe. All right, in a 1 week. What happens? It caused people to go to do those two, either the shot or the to get tested.
I don't know. I have no answer for that. No.
For the non-vaccinated, do they have to get scared enough to go do it?
I don't know how much scared. I mean, now we have the Delta variant knocking our door. We have people that I don't understand. They didn't get the vaccine, but they love to party. They love to go to restaurants. They love to be out there. And they are now out there because other people get the vaccine, because other people took the precautions and the risk to get the vaccine without enough data. And that's something that I never gonna understand. And this is the human being. I think the key is education and communication. I think we're never going to stop to do so. We need to continue educating people, and it's if you are able to convince just one people, you get something at least.
So, Dr. Riccio, there's a young guy, a gentleman I know, he's 25. And when the pandemic first started, he said, Michael, there are only 2,000 people out of 20 million in the state of Florida that have died. Okay, so a year later, there's 36,000 people. He still didn't move. Right?
Zero.
Before it was the rationalization, it was 1/10 of 1% or whatever, some tiny thing. So now it's 20 times higher than that, right?
No.
And he still hasn't thought that he needs it. But the reality is that you take a pretty big chance if you don't get vaccinated.
Definitely. And the outcome is terrible. I'm telling you, it's terrible. So I don't know. It's a subject that is very difficult to address, because I mean, it's human being people, and I understand the fear, I understand the mistrust, I understand the misinformation, but people need to understand. Without research, we're not going to be able to get rid of a lot of disease. We know everything right now, or whatever we know right now is coming from research. Every medication that you're taking went previous to a research process and was approved before you even get the medication. And that's the reality. We want to understand, people understand how important it is be
So,
part of this.
Dr. Riccio, we know that intelligent people that are affluent, have access to a lot of information, typically educated, and some of them make a choice not to go do that. But we have a huge underserved population here in Miami-Dade County, from Florida City all the way up north. What is the University of Miami going to do to help reach some of those people that are not connected, that are afraid, right? That have less family, or maybe they're just older. So what are you going to do to help
We
them?
have a lot of programs that address information about research, about program, the importance about vaccination. You see, we have advertising. We talk in our waiting room with our participants, with our patients, and let them know the importance about, get the vaccine. So we are in campaign. We are in totally, I would say, understanding how difficult it is for people to trust, and how difficult it is for people, especially because COVID was so scary for everybody. And it's important that people understand that it's worse COVID than a vaccine. I mean, there is no 100% vaccine that's going to give you no disease. I mean, you're going to get sick with whatever vaccine you're going to.
So one of the things that we have noticed is that when the hospitals get filled with COVID patients, the people that would normally go to the hospital are not going. They may not get admitted, or they're delaying treatment. I mean, we've seen it. People have delayed all sorts of treatment because they didn't want to go where there's a lot. So it's not just to save themselves, but their family members, all right,
Exactly.
that might need heart work,
Exactly.
or they're afraid to go to the doctor, or maybe because they're doing healthcare on Zoom, that the doctor won't see you, all right, and won't be able to touch you and figure out if there's something else that's going on. So getting vaccinated, whether it's for COVID or these other things, it's pretty essential, right?
It is.
And we know that. Let's talk about some of the vaccines that, if you would, the vaccines that most people have taken over their lifetime. Mm-hmm. Could you tell us some of those?
Mm-hmm. Yeah, so that's the flu vaccine. So why flu vaccine is, I mean, I know there's a lot of information about the flu vaccine before flu vaccine was kind of mandatory, because it's kind of mandatory right now. And I think it's the way that it's going to be COVID in the future. So that's how important. Flu vaccine is not going to give you 100% efficacy. I mean, you can have the vaccine, you can have the flu.
We used to be in the animal business, and when we have people fly around the world, and before they would go to infectious disease doctors. We're going to go to this country. What are we going to catch over there? What do we need? Because we know there are 10 things over there, and they would load you up with the stuff so you wouldn't get the diseases that were in that area.
In my country, it's a mandatory vaccination. So no COVID. We have other diseases that are mandatory. And you're not even asked where the data is coming from. You get the vaccine, period.
So one of the great things that's happened here at community newspapers in the year and a half after we moved stuff around, there hasn't been one cold in the building because of the separations that we've had. The bast for a long time, we were pretty well divided. So we know those things work, right? Because it used to be somebody had a cold all the time. We had a lot of moms with kids, and
No.
it was just like we just lived.
Yeah.
We just lived with that.
Life. Yeah.
So here you are at your nice young age, doing God's work and helping people help themselves. So what is that like for you personally?
Oh my God. As I said before, I mean, I love my job. I love uh, the way that we're helping our communities. I love when you are doing research and you do something like this that is huge, and then you know it's going to be the future, like all of us. You are proud of yourself as a provider, as a doctor, as a human being, because you know you're going to change the way that we practice medicine in the future, and that's huge.
When did you realize that you wanted to be a physician?
I think I have no option. So when I was a child, I just didn't think about anything else. I want to be a doctor. I want to
How
help
old are you?
people.
How old are you?
I was 6 years old.
Did you
7 years old.
did you say it at that point?
Yes, and I didn't have dolls. I have patients. So my dolls were my patients.
So at 6 you were saying it. When do you think you started thinking it before it sort of crept into your consciousness? If you were 6, can't get much earlier. But
Oh my God, I don't know. I have no answer for that, Michael.
like, when you look at people that are very productive and very giving, you realize many times it was inside and it was germinating, it was going, and then finally you have the courage to be able to do that.
Yes.
Right. What I'd like you to do is to talk, and we're going to wrap it up right here. Which camera should she talk to? This one right over there. All right. Why don't you talk to some young lady out there that's thinking about going into medicine?
So I was sad for I don't know. I'm not a motivational person at all, but I'm gonna let people know kind of a little bit my background. So I came from a small town, Barquisimeto, Venezuela. Is and a small town is not the capital, which is Caracas, and I follow my dreams with hard work. I always was a very good student and very dedicated. Then I came after so many years of success in my career in Venezuela. I came to this country who gave me the opportunity to be successful again and to do something productive for people and for this country. And the base of this is dedication, education, and being constant where what you want, and be professional and be committed to whatever you're doing.
Terrific. Thank you very much. Our guest today again is Dr. Anna Riccio from All of Us Research Program at the University of
Thank
Miami.
you so much
I
for
want to thank
having
you
me.
for your commitment to our community and to the country and to the world. Again, thank you for joining us, folks, and we appreciate your time. Have a good day.
Thank you so much.
My pleasure.